Hi there, I'm Dr. Zunaid from Elite Aesthetics, and today we are going to talk briefly about a PDO brow lift. So something that's really important about a brow lift with PDO threads is that not all patients will be suitable for the procedure, and the procedure is given to those patients whom a result can be achieved. So it involves placement of threads just underneath the eyebrow here in the direction of the forehead, 2 to 3 per side, and these are pulled tighter to create this kind of effect where this brow height is increased or enhanced. So to give you an indication of how high we can go with this, you're looking at roughly a minimum of about 2 millimeters to a maximum of about 6 to 7 millimeters. It's about between 2 and 6 to 7 millimeters. And that is all that we are able to achieve with the threads. I'm not really the biggest fan of lifting the tail end a little bit too high because there isn't enough hard tissue surface in this area of the temple where the frontal bone meets the temple. So this is what I'm describing as the fox eye treatment, which in most patients is quite unsuccessful. For this reason, we're not really able to suspend the tissue artificially for a long period of time, and we find that patients don't get longevity from that particular procedure. Other considerations are if there is a lot of excess skin in the upper lid, a brow lift is not really going to be helping the upper eyelid too much, and then we may refer you for a blepharoplasty or surgery to actually reduce the amount of excess skin in the eyelid. If the muscles of the forehead are incredibly weak, or if we will not be able to achieve a lift high enough with threads, this will be told to you at consultation, and we may then refer you for an endoscopic brow lift. Other modalities that go along, that we may suggest, that go along with the PDO brow lift are things like perhaps the use of a toxin, which will help to keep these muscles relaxed and at bay, and this creates a natural compensatory action here, and this in combination with threads makes for a very, very nice result. The other modality that we could suggest is perhaps to give a little bit of support just above this arch here, just above this brow ridge, with a little bit of filler, and again in combination with the PDO threads. But all of these different modalities will be discussed with you during your consultation and examination.